Welcome class to this lecture. I'm Rohit Maiwar. Today I'm going to discuss pharmacotherapeutics. It was a newly added subject in the diploma in pharmacy second year. So today we are going to discuss this subject. It was my first lecture. Diploma in pharmacy second year. Name of subject is pharmacotherapeutics. Subject code is 02. The first unit covers introduction, the scope and objectives of pharmacotherapeutics, RUM, rational use of medicine, EBM, evidence-based medicines, and EML, essential medicine list. So this is the introduction part. What is pharmacotherapeutics? Pharmacons means drugs and therapy means the way of treatment. There are many popular therapies which is available in India like Ayurvedic homeopathy medicinal systems, Siddha Unani, and physiotherapy. There are a lot of therapies which are available in India for the treatment of various diseases. Pharmacotherapeutics means the treatment of drug by means of drugs, and it has pharmacology and pharmacotherapeutics. Pharmacology is the science of drugs. It provides the scientific data about the drugs and how they act, where they act, formulations in which they are available, and routes of drug administration and the doses of drugs, frequency of drug administration, duration, side effects of drugs, desired and undesired effect, and how we can use drugs safely. We study all these parameters in pharmacology. And if we talk about the therapeutics, it is a branch of medicine. It is concerned about the prevention and cure of disease and relief of symptoms with drug therapy and non-drug measures. So that's a brief introduction of pharmacotherapeutics. Now we move to the next slide. There are some important terms which are frequently used in this subject. So before going into it, we look at this terminologies. Etiopathogenesis. Etiopathogenesis is the cause and subsequent development of an abnormal condition of a disease, and clinical manifestation is a clinical condition or manifestation is the physician result of some types of illness and infections. Non-pharmacological management of disease. Non-pharmacological therapies like non-medical treatments referring to therapies they don't involve drugs. They are just a change in habits which can improve or heal the disease just by an alteration of daily life routine or habits. So non-pharmacological management is also important. We study in pharmacotherapeutics. Pharmacological management of disease includes the drugs in the treatment or in therapies. Now the principle of pharmacotherapeutics: establish a goal for therapy. Every ill does not require a pill. Prescribe rationally or not fashionably. Integrate the drug information with relevant knowledge from other subjects. Safe prescribing all the times. Problems can arise at any stage. Be aware of them. Adopt strategies to maximize the adherence. Keep your drug knowledge updated. Know your patient well. Avoid the prescribing cascade. Prescribing cascade is defined as the situation in which the first drug administered to the patient causes adverse effect, signs or symptoms that are misinterpreted as a new condition, resulting in a medication being prescribed. Now we move to the objectives of pharmacotherapeutics. The main objective of pharmacotherapeutics study as follow: provide complete pathophysiology of selected diseases, states, and rationale for drug therapy. The therapeutics approach to management of all these diseases, the importance of preparation of individualized therapeutic plans based on the diagnosis, need to identify the patient specific parameters relevant in the initiating drug therapy and monitoring therapy, including alternatives, time course of clinical and laboratory indices of therapeutic responses and adverse effects. It minimizes the adverse effect of drugs. Now, the scope of pharmacotherapeutics. Pharmacotherapeutics provides the knowledge and skills required for quality use of medicines. Pharmacotherapeutics covers the pathophysiology and therapeutics of diseases. This will enable us to understand the pathophysiology of disease and its management. The selection of most appropriate drugs and doses form, duration of action, and route of administration depend on the particular disease, its state, and the patient condition. Pharmacokinetics and pharmacodynamics of the drugs alter the disease state and patient condition and currently administered drug. And the second scope is the change of the ADME of the drug will result in change in the bioavailability. What is bioavailability? It is the amount or fraction of drug which goes to the systemic circulation for giving action. So the change in the ADME of the drug will result change in the bioavailability of the drug, which can modify the effect of drug and may result in adverse effect of the drug. After complete study of pharmacotherapeutics, an individual has an extensive understanding on how the pharmacokinetics and dynamics can be correlated with the treatment and disease and how the drug can interact with each other. And this will helpful to him to select the best individual therapies. Now, the rational use of medicine is very important. Nowadays, it has been practiced by the many doctors. RUM, its short form, RUM, rational use of medicine. RUM is an important, vital, and caretaker aspect included in the pharmacodynamics because body mechanism of every person vary individually. Like some person are obese, it depends on gender, male or female, it depends on age, and it vary person to person. Due to the involvement of RUM, we decide that the correct medicine for correct individual at the correct time for correct disease. Right dose at right time to right person is very important. According to the World Health Organization, the rational use of drug requires the patient to receive medication appropriate to their clinical needs, and does that meet their own individual requirements for an adequate period of time and at the lowest cost of them and their community. So cost is very important because India is a growing country under development. So it must suit the pocket of the patient, the price of drug. Factor responsible for RUM arises during the manufacturing procedure. It is the initial step or factor responsible for the RUM because during the manufacturing of drug, quality and measure are the important aspects regarding the drug formulation. It is avoided by the involvement of correct platform and correct equipment, correct procedure. Rises due to the individual. The body physiology of a individual varies from person to person. So chemical requirement also varies person to person for treating any disease, and it depends on the different factors like body structure, gender of the person, age, and prior disease history, medical history, drug contraindication or allergic condition, drug tolerance and resistance. Now, come to the environmental factor. Environmental condition also varies place to place, and they also act as a factor like seasonal variation, any pandemic, any mutations. So these are the environmental factors. Ideally, the ideally therapeutically sound and cost-effective use of medicine by health professionals and consumers is achieved at all level of the health system. It is very important, and in both public and private sectors. A sound rational use of medicine, use of program in any country has three elements which are very important. Rational use of medicines is strategy and monitoring. It advocating the rational use of medicine, identifying and promoting the successful strategies, and securing the responsible medicine promotions. Second is rational use of medicine by healthcare professionals, working with countries to develop and update their treatment guidelines and national essential medicine list. It vary country to country, and formularies. It is generally made by the hospitals and supporting training programs on the rational use of medicines. Rational use of medicines by consumers, supporting the creation of effective system of medicine information and empowering the consumer to take responsible decision regarding the treatment. Now, irrational use of drugs, it is very harmful to the patient. So we move on this. Irrational use of medicine is a major problem worldwide. World Health Organization estimates that more than half of the medicines are prescribed, dispensed, or sold inappropriately, and that half of the all patients fail to take them correctly. So, irrational use of medicine means the use of medicine in an improper manner and improper formulation. It involves the by the selection of wrong medicine, by selection of wrong doses, wrong person, and at wrong time. So, irrational use of medicine is ultimately very harmful to the patients. So, we must take care of this. It is also a part of standard treatment guidelines which are developed for providing best of best treatment to the patients by healthcare professionals. And move to the reason for irrational use of medicines. The use of too many medicines prescribed by the patient, it's called polypharmacy. Often these result in the cross reactions between different drugs prescribed. There are many drugs which are in the same prescription, and the interaction of each drug can harm patient if it is not compatible with each other. Inappropriate prescription of antimicrobials, often in the inadequate doses, and non-bacterial infections. Other infections, overprescription of infections when oral formulation would be more appropriate. Failure to prescribe in accordance with the clinical guidelines, and wrong choice of the drug, inadequate doses and incorrect frequencies of administration of drugs, and improper duration of therapy, and failure to observe the drug contraindications. Some drugs are need to monitor closely after administration, and it is responsibility of pharmacist and nurse in hospitalized patient. The effect of drug must be observed, and take care of patient is required. Choice of more expensive drugs when less expensive drugs would be equally or more effective. Prescription of drugs that have no use only for their placebo effects and for impressing the patient, or vested interest in the prescribed drugs. Inadequate consulting time and dispensing time long with poor communication of information regarding drugs to a patient in a verbal or a written form, leading to the incorrect use by the patients, is of great public health concern too and worldwide. More than 50% of the medicines are prescribed, dispensed, or sold inappropriately, while 50% of the patient fail to take them correctly. So it is a bitter fact. Inappropriate self-medication of prescribed prescription only medicines. Now we move to the next point, impact of irrational use of medicines. Ineffective treatment leading to the serious morbidity and mortality, and laterogenic diseases, It is defined as the disease induced by the drug prescribed by a physician, or physician induced disease is called iatrogenic diseases. Or there is a one more term, nosocomial infection. It comes from the hospital facility or hospital setups. If in hospitals the hygiene is not proper maintained, so it can cause infection to the attender of the patients. So iatrogenic diseases are defined as it is induced by the physicians and due to the ignorance of physicians after a medical or surgical procedure in the hospitals or in the OT departments. Inappropriate use of or overuse of medicines leading to the high out of pocket payments by the patients, and this result in patient harm in terms of adverse drug reactions and impoverishment of the patient. Inappropriate use and overuse in the public sector facility where the government pays the bill leads to the wastage of meager resources and shift of funds and away from the necessary expenditure to unnecessarily areas. Increasing antimicrobial resistance. Inappropriate use of antimicrobial is leading to the increased antimicrobial resistance, and antimicrobial resistance is one of the most serious and public health problem globally, resulting in the prolonged illness and hospitalization, mortality, and high cost of the treatment. Use of drugs other than first line drugs, a drug that is used in the first choice for treating the particular condition because it's considered a very effective treatment for that condition with the least likelihood of causing the side effects. In such situation may increase the cost and sometimes the high as hundred folds, make treatment affordable for many governments, healthcare system, especially in the developing countries. In case of out-of-pocket expenditure by the patients. Development and spread antimicrobial resistance are due to the overuse, misuse, or irrational use of by the doctors and self medication by patients, use of animal husbandry and inadequate at aquaculture and agriculture. WHO advocates 12 key interventions to promote more rational use of drugs. First is establish a multidisciplinary national body to coordinate policies on the medicine use, use of clinical guidelines, and development and use of national essential medicine list, establishment of drugs and therapeutic committees in the district and uh, government hospitals at different level, primary and community healthcare centers. Inclusion of a problem-based pharmacotherapy training in undergraduate curriculum and supervision and audits and feedbacks of the clinical establishment, use of independent information on medicines and public education about medicines, avoidance of the perverence of financial incentives, use of appropriate and enforced regulations, sufficient government expenditure to ensure the availability of medicines and staff. Now, if I summarize the definition of pharmacotherapy in short is pharmacotherapy is a treatment of disease through the administration of drugs, responsibility for ensuring the safe, appropriate, and economical use of medicine for direct patient care. Now, what is the need for monitoring pharmacotherapy? It ensures the proper and rational use of drugs and avoid and reduce the adverse drug reaction and toxicity of the drugs, maintain the drug cost at an optimal level, and still provide quality and effective products to the patients. And it ensure the patient compliance and exploit the advances in the knowledge made by the researchers and scientists. So, pharmacotherapeutic refers to the use of drugs to prevent, treat, or diagnose disease as well as alter the normal function, such as preventing pregnancy. Pharmacotherapeutics correlates the pharmacokinetics and pharmacodynamics with the microbiologic and biochemical aspect of the disease. So pharmacokinetic means the movement of drug in the body. What is response of body towards drug after administration? Uh, it involves the study of ADME, absorption, distribution, metabolism, and excretion, elimination of drug from the body. And dynamics means the effect of physiological and pharmacological effect of drugs on the body, its mechanism of action, and side effects, adverse events, and clinical uses, and what are the contraindication of drug, what are the certain conditions in which we cannot use the drug. It can be a specific disease or in the elderly patient or pregnant woman, lactating woman, or newborn baby, infants, children. So there are certain conditions in which the drug is contraindicated. And the teratogenic effect of drugs on fetus. It can cause the phocomelia and the neuronal tube defects during pregnancy. So the appropriate dose at site of action is required for action of the drug. And if the concentration of drug is more than required, it can cause the toxicity and additional side effects can be observed. Pharmacotherapeutics is the treatment of disease by means of drugs. And rational use of medicine required that the patient receive medication appropriate to their clinical needs, and the dose meet the own requirements and the adequate period of time and at lowest cost to them and their community. So here in this you can see the right frequency of administration, the right route of administration, the right dose, right information to the patient. Patient counseling is important. It is responsibility of medical staff, nurse, and pharmacist to educate the patient about medication and give them counseling, how to take the medicine, what is the right way so that they can get maximum benefits of medication and right duration of treatment. Suppose in case of antibiotics, doctor is prescribing medication for 7 days, but patient is only taking for 2 days. On third day, he feels I am okay, I'm right, I am healed, but it's not like that. The course of antibiotic is must be completed by the patient so that reoccurrence of the infection is very less. Right doses form, right indication, right follow-ups. And this is the important points of rational use of medicines or drugs. Use of clinical guidelines is very important in the clinical practices and providing public health education about the medicines. Now, what is adverse drug reaction and toxicity of drug? The study of ADR is the concern of the field of pharmacovigilance. At, when the drug is at fourth phase, drug is in market, but still it is observed by the pharmacovigilance team of the companies. A response to a drug which is noxious or unintended and which occurs at the dose normally used for the prophylaxis, diagnosis, and therapy of disease, for the modification of physiological condition. Drug toxicity may occur with overdose of a medication or accumulation of the drug in the body due to the long period of time, and the patient body is not able to eliminate the drug in a proper manner. It may be a cause. Patient compliance is the major cause. What is patient compliance? The major cause of failure of pharmacotherapy is simply that the patient has failed to follow the instructions for the use of medicine. Non-compliance can be due to the forgetfulness of the patient, confusion, and incomplete understanding of the instructions which has given by the medical staff to the patient. And Ways to improve patient compliance is a good counseling is given to the patient, unit doses form and sustained release products so that patient will take medicine only once a day. So chance of forgetting is very less. Now we move to the next important topic, essential medicine list. What is definition of essential medicine list? Essential medicine are those that satisfy the priority of healthcare needs and the identification and proper care of the disease to the population at all time. What is need of introduction? The concept of essential medicine list is a limited range of carefully selected medicines. It provide better health care. It provide better health management, better drug management, and at very low cost. They should be available at all times in adequate amount, in appropriate doses form, in adequate strength with assured quality and at affordable price. Now, what are the selection criteria for these drugs? Essential medicines are selected with due regards to disease prevalence and public health relevance, evidence on efficacy and safety, and comparative cost effectiveness. Now, what is purpose of this list? Essential medicines are intended to be available within the context of functioning health systems at all times in adequate amounts in appropriate doses form with assured quality and at affordable price to individual or to the community. Community can easily afford the low cost of medicine. Now, the way of implementation. The implementation of the concept of essential medicine is intended to be flexible and adaptable to many different situations. Exactly which medicines are regarded as a essential remains a national responsibility. Now, the history of WHO model list of essential medicines. Tanzania was the first country in the world to compose the essential medicine list. In 1977, first model of list is published by the WHO. That time list uh, had 200 active substances. List is revised in every 2 years by the WHO expert committee and 21st WHO model of EML published in the June 2019. It is very recent and it is a proof that the concept is still valid after nearly 43 years and it continues to have many advantages when it is used approximately in conjugation with standard treatment guidelines. It uses the correct medicine and appropriate indications and appropriate drug considering efficacy, safety, suitability for the patient and cost and appropriate doses and administration and duration of treatment and no contraindications, correct dispensing and including appropriate dose and patient adherence to the treatment. Now, what are the examples of rational use of drugs? Prescribing drugs of no proven value and prescribing empirically, unnecessarily prescribing for self-limiting condition, overdosing and underdosing, and prescribing costly drugs and using injection when oral drugs would sufficient. National List of Essential Medicine of India. It is introduced and controlled by the Ministry of Health and Public Welfare. First, NLEM in 1996 and it was revised in 2003 and second ELM in 2011 it had 348 drugs and in 2015 added 106 and 70 drugs deleted. So ultimately the drug included is 376 drugs in ELM of 2015. Now, the practical application of NLEM. It helps in policy making, management and selection, procurement of drugs and distribution of drugs, quality assurance and financing, promoting the rational use of drugs, training the healthcare professionals and providing the medicine information and education and cost effective therapies. Now, what are the criteria for deletion of medicines from this list? The medicine has been banned in India. It may be a reason. And there are reports on concern on the safety profile of the medicine. And a medicine with better efficacy and favorable safety profiles and better cost effectiveness is now available. And diseases burden for which a medicine is indicated is no longer a national health concern of in India. In case of antimicrobials, if the resistance pattern has rendered a medicine ineffective in Indian context. So here you can see the full form of essential. E stand for efficacy, S stand for safety and suitability, and S stand for storage and stability. E stand for ease of administration of dosage form, and M stand for need of population, T stand for total cost, I stand for irrational combination to be avoided, A stand for availability and affordability, and at last the L stand for listing regularly or updation of the list. So evidence-based medicine, the best research evidence, what is the literature says, and clinical expertise, what the clinicians know, and patient value, what the patient wants, what is need of patient. So this is important points. Editorial and expert opinion. This is evidence based on the opinion of the panel of experts. Case series and case reports. Case series are descriptive studies following one small group of the people, and they are additional and supplements of case studies. The case report is a detailed report on the symptoms and signs and diagnosis, treatment and follow-up of an individual patients, and case control studies, the observational epidemiological study of the person with disease and other outcome is variable of interest and suitable control. Comparison reference group of the person without the disease. Here you can see the level of evidence pyramid, the systematic review and randomized control trials, cohort studies, case control studies, case series and case reports, and editorial expert opinion. This comes in the secondary, and this is primary. So this is level of evidence pyramid. The relationship of an attribute to the disease is examined by the comparing the disease and non-diseased with regard to the how frequently the attributes is present, or if a quantitative the level of the attribute in each of the groups. And what is cohort study? The modern definition of cohort study in clinical studies is a group of people with the defined characteristics who are followed in order to determine the health related outcomes. And Framingham heart study is an example of the use of cohort study to answer the epidemiological questions. The study found high blood pressure and uh, high cholesterol level in blood major risk factor for cardiovascular disease. And randomized clinical trial RCT. And RCT is a clinical research typically compares a proposed new treatment against an existing standard of care. And these are the terms in the experimental and control treatment respectively. Now, what is meta-analysis? Meta-analysis is a systematic statics based review data on contrast and combines the result from different but related studies in an attempt to identify patterns and disagreement and other relationships across the multiple studies. A meta-analysis can support a stronger conclusion than any individual study, but may be flagged because of publication bias. So, what is importance of EBM, evidence-based medicines? EBM gives physician a way to keep up with evidence-based protocols, and EBM enables the healthcare teams to make personalized decisions based on the global evidence. EBM creates a greater transparency and accountability, and EBM improves the quality of care and outcomes. What are the limitations of EBM? The time it is time consuming and require access to the medical literature, and it requires some knowledge of the statistics and publication bias. So, what is evidence-based medicine? In short, can say evidence-based medicine is a integration of best available research evidence with clinical experts and patient values, and integrates evidence with clinical expertise, experience, judgment, and past case studies and patient value and preferences, quality of life, cost, and other important factors. So evidence-based practice moves in this flow chart, ask clinical questions and require the best evidences, praise the evidences, apply evidences to your patients and access effectiveness and efficacy of EBM process. Now types of EBM, evidence-based guidelines, production of guidelines, policy and regulation to be used at the organizational and institutional level. Evidence-based individual decision making, use of available evidences to provide best treatment to an individual patient by an individual physician. What are the resources for practicing EBM? What is the ideal resources? Located in the clinical setting, easy to use, fast and reliable connection, and comprehensive and full text, and provide primary data. And clinical evidence is a textbook and data of clinical questions designed to help the clinician make evidence-based medicine part of their everyday practice. And hundreds of clinical questions and representing nearly every clinical specialty cover the effects of treatment and intervention based on the best available research, and topic include the commonly encountered and important conditions seen in the primary care and ambulatory settings. Now, what is e-medicine? Uh, e E-medicine is an online peer-reviewed medical reference that provide access to the information on the diseases, including the background, differential diagnosis, workup and treatment, medications, and follow-ups. And contributors include the physician and faculty from the medical schools and medical scientists, societies, and additional resources include the clinical calculators, image and CME process, decision rules, and drug information. E-medicine is an electronic format which is available free of cost. Now, what is FPIN? Clinical inquiries. Its full form is Family Practitioner Inquiry Network. Clinical inquiries are produced by the FPIN. Inquiries are a series of questions to practicing physicians, question that help FPIN achieve its goal and provide the rapid evidence-based answer to the family physicians. Now we move to the standard treatment guideline. The standard treatment guidelines are prepared as a tool to assist and guide the doctors, pharmacists, and dispensers and other healthcare staff who prescribe at primary care facilities in the providing quality care to the patients. And guidelines list is preferred treatment for common health problems experienced by the people in the healthcare system. And the guidelines are designed to be used as a guide to treat choices and as a reference book to help in the overall management of the patient and meant for use to all level within the health system, both public and private. So what is definition? A standard treatment guideline has been defined as the systematically developed statement uh, designed to assist the practitioner and patient in making decision about the appropriate healthcare for specific clinical circumstances. What are the advantages for patient? It is consistency among prescriber, reduced confusion and increased compliance, most effective treatment prescribed, and improves the availability of drugs, and it provide the cost effective optimal therapy and drug supply based on the standards. The standard treatment guidelines must match the supply of drugs. And pre-service training, standard treatment manuals are introduced and distributed during the pre-services training, and their use becoming a habit, and regular updates. Change and alteration in the therapeutic preferences is incorporated and updated, and the standard should be revised to reflect the current recommendation. Pocket manuals, the standard treatment are published as a small, durable pocket manuals, which make them convenient to carry and use. So, thank you so much for listening this lecture on pharmacotherapeutics. Hopefully, there are a lot of things you have better understanding about this. So, have a nice day. Thanks for listening. You can make note on this, and in the next upcoming lecture series, I will ask questions about this topic. So please prepare this. Okay, bye. Have a nice day.